I'm Madan, and I'm an advisory member of the National CSR Network. This network was set up in 2015 as an initiative of the Strategic CSR Alliance. This comprises of a panel of professionals from industry, and the role is to assist companies in India to to fulfill their CSR objectives and with measurable impact. And how do we facilitate development and implementation of social and environmental development projects? It is this fiery ambition that has made of helping to make this community a better place to live in that brings me to have this conversation with you today. The network is launching a new initiative called the Heal with Hope at National CSR Network. And through this, what we hope to do is to bring to your home conversations with senior CSR leaders who are driving the agenda of CSR for meaningful social development, even in these times, with great passion. Through these short videos, we hope to share with you inspiring stories and learn some practical tips from the CSR leaders on how you can manage CSR within your organizations. So, for today, I'm very pleased to introduce and welcome Ms Meena Raghunathan from the GMR Varalakshmi Foundation. So, she has been kind enough to accept our invitation, and let's really listen to what Meena has to say about today. So, welcome, Meena. How are you doing?
Thank you very much. Lovely to be a part of this. I think that Hope is a very good initiative of the CSR.
So, my first question to you is could you tell me a little bit more about the CSR focus areas for GMR Foundation?
The GMR group is one of the major infrastructure groups which has operations both in India and few countries other than India. And the foundation is the CSR arm. In other words, we help the group to fulfill its social obligations. We have two kind of focuses, if I may use that word. One is a geographical focus, in that we work essentially with communities around our businesses. So today we have about 20 to 22, 23 businesses across the country. So these businesses might be airports, like the airports we run in Delhi or Hyderabad, or Goa coming up. It may be energy plants in, say, Orissa or Maharashtra, even in the Himalayas, some hydro projects. It is also urban infrastructure projects like SEZs or stretches of the highway. So basically, we focus in communities which surround these, which are our neighbors in a way. So that is the geographical focus. In terms of thematic focus, wherever we go, we work in three major areas, which is access to quality primary education or education, health, primary health again, and looking at the livelihoods of the people. Livelihoods, we have two or three kind of trusts within that. A major focus area of the foundation is vocational training for youth, school and college dropout youth who somehow have not put their foot on the first step of the ladder of a kind of proper professional vocation. That is one target group. The second is farmers and rural communities, how to increase their incomes through farm and non-farm interventions. And the third is women. It could be, supporting self-help groups. It could be setting off, handmade product-based businesses. So we have a major initiative on that. So wherever we go, we kind of modulate these three trust areas to the needs of that locality, geographical requirement, and try to work with the communities on this.
Okay. Thank you, Ms. Meena. I think it seems to be really good. And a lot of this work will really require you to really travel and to be in those places, whether it's the self-help groups, etc. So have you seen, how have you seen the current situation change your approach and your strategy towards ensuring that you continue with the work that you're doing?
it's about, well, we're 45 days or so into the real crisis in India, I suppose, since the lockdown. And we spent a couple of weeks just coming to grips with what this is about. And since then, we've kind of woken up. Uh, what we've realized, of course, all our normal activities are kind of at a standstill. Having said that, we are trying to cope with the emergent kind of situation. One of those is, of course, actually, food support kind of reaction. Say in Delhi and Hyderabad, which are our major presence areas, there's a lot of migrant labor. I mean, everybody knows that problem. How do you kind of support that? It's a huge issue, and any one organization and one like us, we only want to contribute our little bit. So we've been trying to do that in terms of cooked meals, working with the police department, working with local NGOs, uh, giving, whatever we can in terms of resources. For instance, in both Delhi and Hyderabad, what we try to do is we run vocational training centers, which have full-fledged messes and things like that. So we've been trying to use those kitchens to cook a certain number of meals. Of course, those kitchens are equipped not for tens of thousands, but 500 or 600. But whatever we can, we're trying to do. So we are providing cooked meals, about 3,000 a day. We are reaching out to particularly vulnerable members of our community. Every state government, of course, is doing a lot in terms of public distribution, increasing the rations, but there are still some, who are not reached. Maybe they don't have ration cards. We found pockets in Delhi like that. Or, it doesn't suffice, or there are some items which are missing. So we are also trying to give a lot of ration kits to a lot of the vulnerable community members across the country, wherever we have the operations and we know the community. The second thing we are really trying to do is this huge demand for masks and personal protective equipment. Like many NGOs and like many social development organizations, we have a number of women who are trained in tailoring in many locations, and we are basically using their skills, trying to figure out how to get them to make masks. And then donate those to, say, frontline workers, community members. So we've done about 25, 30,000. And there's two good things in this. One is to kind of supply masks to those who need it, include masks and PPE we've started making. The second is that the women are getting an income, which is a big challenge, because one of the big issues is that people are not able to go out to work and make an income. So we're trying to at least cover that in some small way by paying a fair wage when they make the mask. So it's a kind of two-way good, if you can say it that way. You're serving the community by giving public health devices, and on the other, also providing incomes. For instance, we have an SEZ in Andhra Pradesh, in Kakinada, where there is actually a soft toy manufacturer. That's one of the big companies that is based there. They obviously are not doing the regular production. So, the state government said, why don't you give this to us for making personal protective equipment, garments. So we mobilized a good number of women, maybe, about 500 women whom we had trained in villages around. And they are now working for the state government, helping the states to fulfill its requirements. We put SHGs in touch with the state. So that's the kind of two major responses that we've been able to do in terms of supporting this COVID crisis. The other thing internal, of course, is huge, all the backlog of work which never gets done, the routine. For instance, we had about, we are a very SOP-driven organization. So we have an SOP for everything. Mm-hmm. So, but in the routine, nobody kind of revisits and renews and reviews those. So we've been having meetings almost every day, taking up a bunch of SOPs, not only, reviewing those, because some of them are 3 or 4 years old, also looking at each from a COVID angle. How do we now, going forth, how will we do this activity? It could be as simple as we run mobile medical units, where, there are queues of senior citizens who wait for, maybe 15 minutes, 20 minutes to meet the doctor. But how are we now going to do? How is social distancing going to be managed? How is safety? So we are kind of reviewing all our SOPs and trying to put in this element to ensure that when we are ready to open up, we are all there. Mentally, we are kind of prepared as to how to do. So these are the things we've been trying to do to cope with a COVID world and a post-COVID world.
Okay. Thank you so much. So I think this is quite helpful. So if I were to just paraphrase what you have been doing, so you have actually you have continued to do your CSR activities, however, with with a slightly different agenda. And as I can see that being using the kitchens for the from the vocational institutes, you're really trying to kind of leverage the resources that you already have. To be able to really help, the communities, in so I think that's quite inspiring, and I'm sure our viewers can also probably benefit from that. And the second point that I also see that I hear you say is that you are using this time to be able to also look at your processes, your SOPs, and see how you can include the current constraints that we have in the new world. And that really brings me to another point, because clearly we are really hearing about the new normal, and how and I've been talking to some of my friends in the various workplaces, and many of them, they do say that the world is never going to be the same again. And I think the kind of work that you're doing in terms of trying to think through what will be the what could be the processes in the new normal, I think might really really help. So in this particular scenario, I mean, I also wanted to understand, because I know companies do a lot of volunteering activities. And I was wondering how how are the employees of GMR of the GMR group really supporting this. Have you really actively canvassed for any volunteering during these times? So just wanted to understand your experiences on that.
It's really our group chairman who drives very passionately and personally the foundation's agenda. So in fact, every week he's created a WhatsApp group to see what's happening in terms of COVID relief. We send him reports, and every day the direction is increase what you're doing. So the engagement of the top management is very, very hands-on. In terms of volunteering, we haven't really been able to. Obviously, in this situation, nobody can come out of their houses and volunteer. Our own staff, some of them have actually been hands-on cooking and packing meals, and buying rice in bulk and making smaller packets. So some of that, to a limited extent, has happened. People have chipped in with financial donations. So when we sent out a call for dry ration packets, a lot. I mean, not that the group was anyway supporting it, but people also like to chip in, and that's why we sent out that call, and there was a lovely response, wonderful response. We see that in this phase, still people cannot physically go. Volunteering will be difficult, even post this, because going out into the community is not going to be very easy. But I do see people chipping in with all kinds of things. For instance, I was talking about masks. Now, one of the problems we are facing is we are not able to source cloth, fabric. We're not able to source elastic for this thing. So we are reaching out to colleagues, and they're helping us. We know this cloth merchant, so it's a different kind of volunteering, not a very physical thing. And maybe, going forward, they will be ready to take, Zoom classes for some of the students, or, teach a skill, or, help women undergo a training program. So even our volunteering program will have to be recast, but I do know that the desire to do something is there with everyone.
Yeah, thanks. I think that's quite helpful. And if I were to kind of ask you to reflect on the last few days, and if there is one story that you believe inspired you, or something that can also inspire the viewers, we'll be very happy to listen to it.
Some of the women, for instance, in Andhra Pradesh, we have a lot of trained women, and we they didn't even want to be paid for making the masks. that is kind of just amazing because there is no real source of income. And we told them, per mask we will give you this. They said, no, but this is what we want to. This is what we feel is part of our duty. So that was very, very, very inspirational. And some of my colleagues who are out there, I mean, they actually, we run these mobile medical units, so they often go with that because that has permission uh, uh, to communities which are needing healthcare or to transport food and material. As I said, actually physically cooking and packing. So that this it's a kind of very heartwarming thing to see how they're putting aside personal fears and plunging into this.
Yeah, thank you so much, Ms. Meena. So I'm sure that we have benefited a lot, from the sharing of experiences. So clearly, here is a great example where the GMR Varalakshmi Foundation has found an opportunity to really make a difference in the communities. And while the CSR programs, like some of the projects may be shell, but then there is a different approach and a different way in which the activities continue to happen in terms of using the current resources, be it the kitchens, be it like engaging with the women tailors, etc. So. Today's and this really is a reflective of what organizations could do to be able to really help the communities come out of like a situation like this. So thanks like Mr. Raghunathan so much for joining us today. And dear viewers, we hope that you found this conversation useful. And if you do have any questions that you'd like to ask either Mr. Raghunathan or even the National CSR Network in terms of the work that we do, please do write to us. We'll be very happy to support you in any way we can. So I would like to wish you all the very best, and please do stay healthy and positive during these times. Thank you.